All right, I'd like to call the meeting to order. Dave, can you do a roll call?
Thank you. Director Gallardo. Treasurer. Secretary Avalos. Vice Chair Herrera.
Here.
And Chair Seremian and Chair Avalos, excuse me, it's mispronounced here, are not present. No, it's
listed here as Avalon.
Yeah, I'm
Rosemary.
Alanese. It's listed on the minutes incorrectly.
We'll get to that.
All right.
Okay, time for Pledge of Allegiance. Thanks for coming. I'd like to open it for public comments. This is an opportunity for members of the public to address the board on any matter related to the district that's not listed on the agenda. Comments will be limited to no more than 3 minutes. Hey.
Good evening, everyone. I just wanted to give you a quick update in regards to this summer's swim program. Unfortunately, we did receive notice that the high school will be undergoing renovations to the pool, so there will be no pool this summer for the community. At this time, we're currently reviewing options for other summer programs, so as we confirm or finalize that stuff, we'll bring that back to see if there's any interest in partnering, but at this time, there will be no swim program at Selma High School.
I was just wondering, since we're on audio as well, if you could just state your name for the record.
Oh, yes, sorry. My name is Amy Smart. I'm the Community Services Director for the City of Selma. Also, just as an FYI, today we did break ground. We had a groundbreaking ceremony for the new park at Brettlinger. We're very excited. It's about a 3-week process to get that new playground equipment there. The project total is about $350,000. Brand new playground equipment. It's a fully or as inclusive as we can possibly be. So we did opt for pour in place flooring for the park. So that children of all abilities will have the opportunity. We also have a ADA transfer station. We included a merry-go-round for those with wheelchairs or walkers and other equipment within the park. So our vision for that was to create, like I said, a park where children of all abilities will have the opportunity to play in regards to in addition to the normal playground equipment that you would see at any other park. So again, we anticipate that project taking about 3 weeks, and we will have a ribbon cutting ceremony likely on April 13th, but we're finalizing those details with the construction company that we're partnering with. So we hope that you guys can help us spread the word. It's a much needed asset to our community. So thank you.
All right, item number 6, potential conflict of interest. Any board member who has a potential conflict of interest may now identify the item and recuse themselves from discussing and voting on the matter. Any potential conflicts of interest?
Mr. Chair, we skipped over item number 5, but because this is technically a special meeting as opposed to a regular meeting, we're not allowed to amend the agenda anyway. So I just wanted to call that to your attention.
I knew that.
You know.
Thank you. All right, item number 7. Approval of our past minutes, February 9th.
Sure, I'd note for the record that we have a correction for member Alanis on the first page of the minutes.
Also, Dave, On our agenda, it says approval minutes February 9th, but the actual minutes are dated
February
February 6th.
I do believe it would have been the 6th.
We have a motion to approve minutes
With amendment.
with amendment. I second.
Roll call vote?
Do you want a roll call or?
Yeah.
Okay.
Roll call, Dave.
All right. It would be Secretary Avalos and Treasurer Leticia Gallardo
Yes.
and Vice Chair Herrera.
Yes. Right, item number 8, informational items, number 1, treasurer report.
Okay. So this treasury report will be from May 2023 all the way to current. So do you want me to read all this over? Because the last time you were in a hurry,
It's probably not necessary to
or you
read.
just want me to do the
You want to
current
just,
year?
well, what you could do is if you wanted just to provide the total amounts, like the summaries of the amounts, because I'd hate to have to see you read every
Okay.
check, but we'll just
So
make sure that it's included.
Today's
in the
balance
future.
was $469,415.81. January's balance was $388,660.33. And February's balance was $388,625.82. And the board members, you guys have a copy of the bank statements for a whole year, including up to date.
I just want to add one thing from our last meeting. We had an issue with a check from the police department. I just wanted to let everybody know, Chief contacted me the following day. Actually, he came down same day of the meeting, but that issue has been resolved. Thank you. Item number 2, website improvement demonstration. Joey? Oh, Joey, can you let us know why we're doing this upgrade?
Sure. So let me share my screen here. We're looking at here is the healthcare district website. The reason that we wanted to make this improvement was to make it easier for those with disabilities to be able to see the website. So this one in particular took some time to get to this first initial phase. The way we were able to do this is with a widget on the website. It's on the bottom left typically, and I believe on mobile it'll be on the right side. Just depends on what it is. But the widget will allow the user to then be able to toggle depending on their disability. For example, those that possibly suffer from seizures, they can toggle this, and it, just like it says here, it clears anything on the screen, flashing, which this website doesn't have that, but it'll also reduce the colors. Another profile that can be turned on is for those with vision impaired. So it'll enhance the colors, it'll make things pop more. There's also an ADHD friendly profile. So this will have like a magnifying, it'll darken everything else other than where the mouse is hovering. So that's a nice little improvement. Cognitive disability profile, so it puts, these borders around different items. And then the one that's pretty neat is this keyboard navigation motor. This will allow those to navigate the website with just their keyboard. If we had a screen reader, we'd be able to hear also as well different elements. So it will actually see what's on the screen. For example, this picture would describe what's on there for those that are blind, even the wording. So it's pretty intuitive in that regards. There's also the ability to make the text bigger. Let's see here. We can change the text sizing. We can align it to the right or align it to the left or in the center. There's also quite a few other options, like to make it dark contrast. So it works pretty neat. Doesn't matter what page you're on the website, it will still be there. You need a bigger cursor, you can change it to a black cursor or a white cursor. So there's quite a few upgrades in this regard. Does anybody have any questions?
Are the districting of the maps up there for,
Yes, that was updated as well. So we have the map that was provided. And then the other 4 or 5 maps. I think these were the new ones that were done in 2022. So those show all the different zones zoomed in.
Joey, if you could scroll up to the text there between, one of the things that occurred to me while I was working with county elections is that the boundaries can change as the voter registration changes and the elections, county elections is working towards an election. And so the data could change, and rather than rely exclusively on these maps, the text here also directs folks to go to the elections department, because that's the agency that owns the data. So this will get them in close, but if they really need to know, or if there's been any changes, then the readers are directed to go to the Fresno County election website.
Joe, you might have mentioned, but what's the drive behind the ADA? Was something that there's a deadline coming up, or?
Answer that?
Hmm?
You want me to answer that?
Sure.
There was, there was an incorporation of the American Disabilities Act into public agency websites not that long ago. And candidly, to be honest, is that there are these plaintiffs' attorneys out there that are suing districts and collecting attorney's fees irrespective of whether or not the website actually changes. So it was very important to us to modify the website to comply with the Americans with Disabilities Act in order to ensure that our residents have the ability, irrespective of disability, to use this website in a fashion, but also to protect the district, to ensure that we're not unnecessarily targeted. Very similar to what we went through when we made the districts, yeah.
And in regards to the cost, still working on that. So stay tuned.
You also mentioned there was work to be done, a couple more things.
There's the minutes and agendas. We're still working on finding a way to remediate those, because they're essentially PDFs that live on the website. So we have to find a way to make those accessible, just like the entire site itself. So So we're working hard on getting those remediated like the rest of the site. So that's what we're working on.
Um, did you have to consult with others who are doing this or something that you just kind of figured out?
Nope, I had to just consult with vendors to get the solution to where it is now. So we're still working on the other part. 'Cause it's pretty complex.
Okay, yeah. Just asking instead of, I was just wondering, if we can consult other district, maybe it has websites that's already done what we're trying to do.
Yeah, what's interesting, I've gone to look at the other websites briefly and this solution itself is unlike any others. They don't have this widget where they can choose depending on what disability they have. So I'd be surprised if they're not on in compliance like this.
One last question. So the widget, is that kind of a known widget that people with disabilities would know to click on that?
Yeah, there's options to change the logo. We could make it look like a wheelchair, but yeah, that's the typical widget that's used.
Good. All right, I like the changes.
Yeah, Mr. Vice Chairman, if I could sort of add on to what Ken said, that I had asked when I started here, I had done some research with some other healthcare districts to get a sense for what they do, and at least one of them did not have a website. So when I called, they said, "Well, we got hit." And they're updating their website, but the groups that Ken has mentioned have sort of been through town and so this, I definitely believe this is protects the district's interests as well as Ken said, makes our website more accessible to folks with disabilities.
The front page of the website. So if you scroll down, do you notice where it says click here for agenda? That's actually another Brown Act requirement. So under the Brown Act, you're required to have the agenda in a noticeable place on the front of the website that's easy to see. So you can't, it has to be accessible with one click, not two clicks. So there's a host of different requirements out there that you have to comply with that, are applicable to governmental entities like us.
What about our financial reports? Should they be on there too?
So what we want to do is to include a provision that has the current staff reports and the old staff reports. And included with the old staff reports would be the financial records for the agency. I think it's really critical. And another thing that I know Dave and I have talked about is the idea of having our policies clearly enumerated on the website so the public just really understands what our policies are with respect to a host of things.
So then probably, okay, wait, just the financial report. Should it be overlooked before it goes on the website, or we have to have the meeting and then it can be placed on the website?
So
Is-
normally the way the Brown Act works is anything that's provided to the board in advance of the meeting within 72 hours is available to the public. So whatever board packet goes to the board should be uploaded onto the website. And then if the board looks at the financial report and says, this isn't right, we need to make a couple changes, then that would be amended and then put back onto the website.
And that also may change the character of our treasurer's reports too, not to include any proprietary information, account numbers, something like that. So it may be,
They
it may
don't have,
be,
I just put the balances, well, now bank charges, deposits, check numbers, who they're like attorney fees, and then the invoice next to that, and then the amount that we wrote, that was written. I don't know if
Totally
that,
public. That's, public gets a right to see that.
just, It's just, that's all it is. It's no, there's no, what did you say right now?
Proprietary?
Oh, account numbers.
Yeah.
There's no account numbers.
Okay.
Only the board members have the account bank number, the bank statements. They're the only, it doesn't go on the website ever.
Dave, is that something you'll be looking at, working with Letitia on getting those?
Yeah, we'd need to get those, if part of the packet that gets distributed to the board ahead of time. But yeah, I think the critical path at this point is for Joey's work to convert PDFs, something that's readable. That's gonna, once that's complete, then we can start putting these, putting all the information that the board is looking at currently on the website after or prior to our meetings.
Thought on that. Can we get that without waiting for the ADA compliant? Just to be
It-
more transparent to get it up there? Because we already have some PDFs that aren't compliant, but they're there.
Mhm. If that's the direction of the chair, yes.
You look up on the website, it looks like, we always have our audited financial statements, our minutes and everything. So there's really, yes, I mean, the answer is yes.
It would just be another field agenda packet, something along those lines.
Any other information to add?
No, that's it. I'll keep you guys updated as soon as,
Okay,
thank you.
good work. Anybody in the audience or a public comment? Anybody online? Okay. Move on to item number 3, presentation by Avitas Health.
Good evening, council. John Calhoun, ED ICU Director here at Selma. Adelie is going to go a brief overview of the grant project report that we've generated for you guys. And I just wanted to follow up on a few key points. So Adelie, take it.
Thank you very much for having us here tonight to give a presentation and an update on the status of how the project is going. As we know, the Selma Healthcare District partnered with Adventist Health through your mental health grant initiative, which did start last year, I believe in August 1st. During that time, we put in for a position to hire a licensed clinical social worker who is going to provide direct mental health services in a unique position that was created at Adventist Health. This is a pilot project and the first of its kind for our organization and all of the markets that we serve in the Central Valley. This position was going to work 3 days a week in the emergency services department, 8-hour shifts, and then 2 days a week to work in our clinic, both located in Selma. I apologize. We interviewed several different candidates and extended an offer to a licensed clinical social worker, Raquel Caraway, who has been, had attended previously during our board meeting, who you met. We hired her and her start date was January 11th. She is a provider, so with credentialing her, going through onboarding, training, specifically training her to do 5150 holds in the lift holds in the ED. She was ready to start seeing patients January 18th. So this report that you see is going to be for patients that were served in the clinics and in the ED from January 18th through March 18th, yesterday. And I'm going to have Donald Calhoun, our ED director, just go over some highlights, success stories. We'll talk about some challenges that we've had implementing this project and some strategies on how we can enhance the project moving forward.
Yeah, so on section 6, it's a few pages in. It talks about the summary of key findings and proposed improvement strategies. So there has been a positive engagement. Patients are actively participating in the service we're providing and experiencing tangible benefits, indicating the effectiveness of our interventions. And I think the interventions is really key. Someone like Raquel, who's not just at LCSW, she's also providing treatment at the bedside when patients are at crisis and is able to kind of close that healthcare continuum, if you will, by following them up in the clinic setting. So we have a crisis setting in which our goal is to either stabilize or get them to a higher level of care and then have them follow up here at the clinic. So the last 2 pages we can go over, but you can see where some of these patients were seen in the ED and then referred to the actual clinic. Providers at the ED and clinic level are well informed of our new mental health services. Previously, there was nothing like that in existence at the acute care level, meaning the hospital. So this was exciting for us. They're actively engaging with her. It's not uncommon to see an ED provider, an ED physician, go up to Raquel, hey, what do you think? I got this patient in room so-and-so. Can you go in there, talk to them, and give me, your feedback on our next step? That's not just supported by the ED provider, it's also supported by Telepsych, which is a psychiatrist provider that logs in remotely, and they're able to provide recommendations. But that was really the gap we had, right? Until we received the grant and Raquel, we were only able to receive recommendations. And it's hard to put a patient on a pathway based on just that. So it's been huge for us. Fostering collaboration and comprehensive care delivery. We talked about that continuum of care that continues. In our last meeting, we had a brief luncheon, but we were able to identify areas in which we had addressed with you guys the last meeting. Community outreach. The mobile unit was out of service. It is now in service. So Raquel will be participating in our community outreach or mobile center to meet with patients outside of the hospital. We identified community partnerships, fostering partnerships with key stakeholders, Selma Fire, Selma PD, and having some sort of marketing push towards those areas, towards those units, just so there's some awareness, right? Because we still have PD. We don't want to utilize them if we have the resources at the hospital. So already with Raquel getting her certificate to lift and place 5150 holds, we've seen a dramatic decrease in our use of our peace officers here in our community because she's able to now place or lift those holds based on her assessment. We are working with our Adventist marketing team. We'd like to push out some marketing materials to these agencies. That's what I was looking for. Introduction to law enforcement, first responders. We're thinking some kind of meeting that we can hold, a brief luncheon to meet with the fire chief, the police chief, and any other stakeholders, the school district, and probably the community mobile unit, so that people know that that service is available and she's ready to see patients.
Oh, Don, on that thought, once you do put that together, can you notify David?
Absolutely.
'Cause
Absolutely.
I know I would like to be
Yeah.
part of that.
We'll have Deli Delicious. It'll be fantastic. And really addressing no-shows, that's part of the continuum of care, right? We understand that these patients have issues like physical dependency, homelessness. So it's really important for us to do what we need to do to try to get them to follow up, right? When we can prevent patients going into crisis mode, we prevent a lot of the other stuff that goes along with that.
Requested as part of this report, the types of services that are being provided. And we did provide that in this report. Section 4, I'll just have Dawn go over just some of the key services that are provided in our ED to give you an idea specifically, and then also in the clinic setting.
Yeah, so self-harm, suicide, ideation, or attempt, we're able to conduct an initial consultation. This is at the crisis piece. We're able to complete the suicide screening and the PHQ-9. We're able to offer direct psychotherapy services if interested. We're able to provide counseling and crisis resource list for those who, otherwise would have been stuck in our emergency room waiting for a higher level of care because of the uncertainty. Raquel's able to bridge that gap with her area of expertise and prevent things like that from happening. So we decongest our ER for patients who truly need our services in that time and moment, and the patient gets the follow-up care that they need. Low risk, we offer outpatient resources, direct behavioral health services in the clinic. And for moderate risk and high-risk patients, we connect with Selma PD for the 5150 assessment application. That's not We've kind of bridged that gap as well with Raquel being able to now lift and place holds. Collaborating with the doctors and nurses for their actions if the patient is in fact placed on the hold. Anxiety, depression, and any other behavioral health rationale. Ooh, that's a lot.
Yeah, we'll just go over the.
Yeah, unhoused individuals, homelessness. We actually, yeah, my mind was going somewhere else, sorry. Potential co-occurrency substance use and behavioral health rationale, potential victim and assault domestic violence, and we can offer a schedule for psychotherapy services appointments before the ED discharge. So before the patient even gets out on a safety plan with the family member, we can have that referral in place so that they can follow up at the clinic setting.
Now, would they be following up with Raquel?
Yes, The idea there is to kind of to build her schedule out. It's early on, and so they're working through that. I can speak for Ray, who's the director of outpatient services. We're actually redirecting referrals that are waiting just because there are no available appointments to Raquel, with the focus being Selma residents, people in our community.
So there may be patients that don't necessarily get seen in our Selma clinics or through the ED that we may have been referred over by another healthcare organization or one of our internal sister hospital clinics in Kingsburg, Fowler, Sanger. We have a lot of different clinics that may be waiting for behavioral health referral services for consultation for psychotherapy that we're not aware about. So we're trying to capture patients specifically who live in Selma so that we can direct those patients the 2 days that Raquel is available for psychotherapy services. So that's an opportunity for improvement for us, is trying to fill her schedule and going outside and looking at the referrals that are not coming in through the ED specifically that we can also help assist with.
I have a question. On B, residential information of patients. Okay, it shows that you have, besides Selma patients, you also have Fowler, Parlier, Kingsburg, Delray, Riverdale, Dinuba, Sanger, Fresno, and Orange Cove. Okay, do you get monies from these cities too?
No, we do not. Monies as in grant money for.
Well, like you've come to us
No.
for monies, why don't you go to their healthcare also and ask for monies?
Well, this grant was specifically to help address mental health here within
Yes,
Selma.
I understand that, but if these patients are from outside of Selma, shouldn't those cities also be paying?
Unfortunately, we're not able to,
I mean,
I
go
think-
sit in on their health board and ask them.
it would be unfair for us to pick only residents from Selma that are gonna, benefit from this service that's being provided to this community residents. These services go beyond just
I
impacting.
understand that, but what I am saying is you can also go to their healthcare boards and say, hey, we are providing this service for your residents. Can you help us out?
We do partner with our other communities where we have clinics to provide different grant-funded projects in their community. So for this specifically, we're targeting our Selma patients that are being seen in the Selma ED and the Selma clinic and residents as well. I don't know if you wanted to provide any other feedback.
Yeah, and I just want to add to that, that when we first met, the area of focus was providing a service to our hospital, which serves our community. We're very fortunate at the city, our city size, to have such an establishment, right? With healthcare and reimbursement rates the way they are, you know, there are several hospitals that have gone out of business, unable to provide any type of service. In the very first meeting, we also discussed the need for such a service, that we were really behind as a community on the standard of care. Every other emergency room that I've ever been in has a social worker available. And so I remember that first meeting, we thought this would be a great opportunity for us to show you the type of services that we can offer the residents in Selma. Now, we can't be selective, we all understand that, but I think supporting our hospital in our growth is a super important thing. And our community sees that.
Great.
Yes, I understand
Yeah.
that, you know, helping our community,
Yes.
okay? But then again, you have other venues that you can ask
Well, so, and
also.
part of it, please keep in mind, is some of these patients may be living in Fowler or Reedley, but they're right here in our city,
Great, when they need,
and they're in crisis.
in crisis, yeah.
So the people you,
So does that mean like my husband does, uh, he's a property manager. And he's forever having to throw people off the property because they're drunk, they're on drugs, they're doing a lot of things. So that means we could send them to the hospital?
absolutely, if there's a medical need, the hospital is obligated by law to see patients regardless of their ability to pay.
I just wanted to make one comment about that. It might help is, if you recall, the way the RFP works is that this district, is essentially giving a matching contribution to Adventist. So in looking at the numbers, you know, roughly half of the patients, slightly under, but roughly half of the patients are actually residents of the city of Selma based upon the data presented by Adventist. So in a sense, if you think about it, half of the contribution for this project is still coming, if not more, is still coming from Adventist, and we're paying for half. So in effect, Adventist is, you know, for lack of better term, sort of paying for the non-Selma related residents, and this district is paying for the Selma residents.
Right,
And-
if I can add to that, I totally agree with Lorraine. You know, we should do as much as we can to take care of the residents in Selma. However, I do realize crisis happens no matter where you live. If you're passing through, staying with a friend, if you have a crisis, you're gonna go to the local hospital. So I think this is a great pilot program, and hopefully, you know, once we get the data behind us, you would be able to take that data to maybe some of the other surrounding communities and say, hey, this is a pilot program we started with Selma. What about extending it to your community? You know, a partnership with them as well. You know, perhaps that in the future.
I know that our Kingsburg community heard about the partnership that we did with the Selma Healthcare District, and they were very excited just to know that we started something, and they did mention to us that they would like to do something similar in their community. Right now, we're focusing with Selma because we want to try to get a good process and wrinkle out any kinks that we may have that where we can improve this project. But I think that you will also see that it's going to directly benefit more Selma residents once we start doing our community outreach. That's going to be scheduled once a month. Our LCSW is going to be with our mobile unit that provides no cost services. So they do health screenings, outreach. They have resident doctors that participate in the mobile clinics. So they'll be reaching out to students. I know they'll be participating in different events that target homelessness and residents of Selma. I think once you get the next report, you're gonna see a little bit more about that. I know you were not able to attend our last meeting that we had at the hospital. Raquel had some ideas of doing some, they were like collaboration with the school districts on doing some education with parents, like signs and, to look out for if someone is having suicidal ideation, tips for parents with stress. I mean, she can probably elaborate more beautifully than I can because that's the line of work that she does. But we also don't want to duplicate work that may be already conducted at the school level. So our plan is to hold a meeting with community organizations and stakeholders so that we can collaborate and see how we can help support them with the use of our LCSW, providing some type of collaborative event with that specific organization. Aside from what we're doing with patients that are being seen in our clinic and in our hospital.
I guess I just wanted to share, and, I know the focus is on Selma, and this is a Selma patient, for privacy reasons and HIPAA, we're going to keep it just a very young female from Selma that was recently just seen here, who was essentially catatonic on presentation, nonverbal, and suspected for sex trafficking, type acts. And so that's, it's present in our community. And to me, the 4 days she was waiting in the ER for reasons I don't want to get into medically, Raquel was there to offer and give treatment at the bedside during her crisis. That's something we never would have had before. The reality is, you look at some of our neighboring hospitals, patients will sit without any type of treatment for days, sometimes weeks. So what we've done is we've accelerated her care, her path to hopefully some wellness, and follow up, and really kind of closing that loop on the continuum of care. And I know that's one out of 40 or so patients we have listed here, but I felt that one instance was almost worth the money itself, because this is happening in our neighborhoods. I myself have family in this community. I shop in the stores here. It's not uncommon for me to shake hands with people at Walmart or Food for Less. So it was satisfying for me personally to see what you guys have helped us put into place actually work in a very positive light.
Good work, Don. So in that scenario you mentioned, Don, in the past, you would have just had the tele-psych just over a video. Is that in place
Yeah,
of Raquel?
Yeah, and the telepsych's interesting because the provider is not going to make a provider-based recommendation. They're making recommendations based on their area of expertise. So it becomes somewhat of a liability issue, right? You have a provider who may be licensed in another state providing that type of guidance or information. But it was big because the medical reason she stood there for 4 days in our ER was because she was refusing care. And it's really hard to place patients at higher levels of psychiatric care if they're not medically cleared first. And so it's a broken system, right? But knowing that Raquel was there day in and day out to provide her therapy was a huge win for everyone.
We kind of went over a lot, but if you have any additional questions or feedback, we're happy to answer any questions or.
Any questions from the board? Is that a yes or no? Board, any questions?
Looking at how many patients we're seeing.
Yeah.
This is just a limited time, correct? So January to March?
Yes.
March, okay.
And then just keep in mind that this position, because it's hybrid, they're not working full-time in the clinic or full-time in the ED, so they're splitting their time. The good thing about this position is that when she is in the ED, and if let's say there's a patient that presents to the Selma clinic and we're not able to place them in for a therapy appointment, Raquel can walk over and, do a warm introduction and establish that relationship with that patient so that they can get an appointment and kind of hold them over until they're seen. So as we were building up her schedule, it's typical just with any provider, whether it's a medical provider or a behavioral health provider, when they're starting, they normally have a lower number of patients that they're seeing as they're building up their schedule and working on filling their schedule up. So this is just 2 months data. And so we anticipate seeing a large volume increase in the next few months. And hopefully, just seeing a robust program by the time that we finish our 1-year pilot program. And we also would like to invite you to our next transition of care meeting that we hold at the hospital every month. So you could be part of those discussions and provide your feedback. You'll hear us talking about just highlights, what's going well, what could we improve on. So we'd love to have you there. I know we had a board member say maybe they can come and see her in action. And so we'd like to work with you so that we can get that set up as well.
I know I'd like to have made that last meeting, but I was working.
And when we say see her in action, I mean, it's a slow process, right? But I just want to close for me in that this is really about improving our community's overall health. And I think that's what we're doing. I know that's what we're doing.
Great, thank you. Yeah, I'm excited to see where we go from here. It can only get better. Thank you.
Thank you.
Okay, on to item number 9, action items. Number 1, select quarterly meeting dates. I don't know if we're gonna be able to do that. Do we have a calendar from City Hall to know what's available?
As a matter of fact, I was on the Selma website today, City of Selma, and made record of City Council, Planning Commission, Personnel Commission, Recreation and Parks, Pioneer Village, et cetera. And I also received a text from Member Alanis regarding dates that she's blacked out. So we can come very close to develop a schedule of the remaining quarterly meetings. And if there's any need for a special meeting ahead of time, I know we're going to be talking about a workshop. I think I've got some data here that will get us very close.
You wanna pick those dates now?
Well, with the participation of the board, and you're all busy people, I would recommend that we have a meeting in June, since that's the end of the fiscal year or the last month of the fiscal year, and would allow the board to adopt a budget. But May is available as well. April is not a good month for me since I have some vacation plans to chase the eclipse all the way across the country. So I'd recommend that we look at May or June with an emphasis on June. And then the other 2 meetings would be at the discretion of the board.
But typically quarterly.
Yeah, I think we kind of missed the quarterly bus when we had our first meeting in February, but yes. That would be, first quarter. That could be in September and November. Just ballparking for the board.
We typically do our meetings on
Tuesday was the only day I know I have off.
Tuesday, the 4th is the only open day right now with all the calendars that I mentioned. That's
June.
available,
June 4.
okay?
graduation.
Graduation.
Might be.
We have Rosemary's schedule. Is she?
He'd be available.
The fourth,
But if, I'm sure if it's a graduation day, that's not good for
right?
many people.
I'm just there.
Friday, they're,
Yeah.
they're. With the fourth. So June 4th?
June fourth, we can always change.
Same time?
Same time.
Oh, no, I'm sorry, graduation.
Okay.
Already.
June fourth it is.
Actually, September Tuesdays do not look good. In the various calendars here, whether room is booked or has some board meetings.
Did no September at all?
No Tuesdays in September.
But
Would Monday night work?
I could,
They have council.
I
Oh,
could,
they have
oh
council
yeah.
Monday.
How about Thursday?
16 and 23?
No.
That's,
The second is Labor Day.
So that would be the 9th. September 9th is a Monday is the only,
Ninth,
or the 30th.
9th?
the ninth.
Monday night. No,
Exactly. Well, hold on one second. You know what?
So September 9th?
Yeah.
Monday,
Okay.
September 9th at 6?
I'll swap a day from somebody.
Monday,
September 9th.
Will that work for you, Joey?
Why?
Yeah,
Then how's a Tuesday in November that's not the 12th?
oh,
Do the 19th.
that's election day, isn't it? Fifth.
Hmm.
Any other Tuesdays work for me.
19 or 26?
Thanksgiving weekend,
Yeah.
weekend,
You're right.
That's good.
19th.
19th's good.
19th.
Okay.
Yeah. That's good for Rosemary as well.
Okay, and so those dates,
Okay.
when will, proposals have, their date to be turned in? the
Three.
3
weeks prior to the meeting date.
3 weeks prior to the meeting?
Yeah. Tuesday, November 19th.
Now, are we going over, what we're gonna be amending for the policy for the proposals? Are we gonna go over that or,
We'll talk about it coming up
oh,
when we get to the workshop.
okay.
Dates are set.
It looks like June 4, September 9, and November 19 for the balance of the quarterly meetings.
at 6 PM.
6 PM.
Okay,
Thank you.
thank you. All right, action
Number
item
one.
number 2, budget, 2024-25. Discussion and approval.
Well, bear with me
What-
for a
what-
minute.
What did you guys mark for the
Yeah, what are the
16th?
dates again?
For the meeting,
11,
Yeah.
16?
June 4th,
June 4th,
September 9th,
9th,
and November 19th.
and 19th.
19th,
Oh, okay.
On my calendar that I'm supposed to be in Los Angeles for a meeting on the 4th. Could I have someone come in my place? Would you be comfortable with that?
What month is that?
That's the June
June.
4th meeting. I'm supposed to be at a conference in Los Angeles.
I think
Okay, I'll
any of your fill-ins in the past did well.
Yeah, I have Craig.
Yeah.
Great job.
Oh, yeah. All right, David, budget?
Thank you, Mr. Vice Chair. This is an action item, but it's really just review and provide direction. At the board's last meeting, council recommended that the board not take action on the budget pending the hiring of your executive director. And so here I am, and I was somewhat challenged by the general absence of the brains of the administrative side of this operation, with Debbie being out of the country. She made herself available, but I didn't want to hamper her all the way across the world. In the meantime, the treasurer was very happy to provide the information I was looking for. I still have some more information I need to get, essentially the grants that have been awarded to date. You can see on the worksheet in the back, there's a lot of TBD. So to be discovered, I guess. But what I'd like to provide the board with a context of how I would like to see this budget work towards the end of the fiscal year. And that is that we have a column for the approved budget, an actual to date, and a proposed final budget where amounts were above expenditure, authorized expenditures, or below. We can get that information to the board so that it can make take a decision on the proposed budget. So this preliminary budget is still a work in progress. One thing I did note going through this worksheet is that the district has a revenue stream of a little bit more than 200,000 a year, and that goes up with increase in property values. But our expenditures on the grants are 150. There's the district-led initiative at 100,000, and there's the mini grants at 50,000. So that really leaves about 50,000 for staffing, the annual audit, which consumes about 10,000, insurance. When we need an election, we need to pay the county, IT support, professional membership. So I don't know if district can afford an executive director for too long. There's a bit of a surplus right now that I'm happy to expend in the district's service. But I think that the district is at a point where it needs reliable staffing. It doesn't need full-time staffing. And I would like to, as I said in past comments to the board, I'd like to meet with each of you and find out more about your motivation in working on the board and what your plans are and how we can work together and how I can assist both you and council in working towards the goals of the district. So I believe there's going to be sufficient funds for the executive director, staffing, legal counsel in the next year. But there's going to be a moment where the board will have to make a decision in terms of how much staffing it wants. And think about it this way: the more staff that the board has, the less work members have to do as treasurer, secretary, or vice chair. The more staff you have, the less you have to do. So if we reduce staff over time, then that may mean there's an increase in what the board members are doing to make up for that. So it's a balance that you'll be looking to
So we
solve.
have to have a special meeting for personnel matter?
Not necessarily. This will give me time to, the June hearing date for the quarterly meeting may be appropriate. I'll leave that up to the board if you want to have a special meeting. But I think it's really about an evolution of the district and evolution of how the district manages its grants, how it manages the administrative side. If there's 50,000 in Freeboard, if we just look at how much the board has dedicated to grants, but there's a little over 200,000 in annual revenue, that means you have 50,000 to play with. And 10,000 of that or more comes out with the annual audit by a CPA. So the more I start looking at this, the more I think that it's good to have an executive director, in my opinion, but I don't know if if it's in the board's financial interest in the long term to move forward with assuming that you're going to have a part-time executive director working 20 hours a week or 8 hours a month. We'll have to kind of find that sweet spot. This has been a tough month for me as I'm on this side of the learning curve, but I'm getting near the top, and I think that I will have more information to provide the board at our next meeting in terms of what some options may be. I'll reach out to other healthcare districts and see what they're doing for this. Now, they may have more revenue, and this may not be a problem for them. I think 200,000 with the grant program that this district has is puts us in a position where there's going to be kind of an executive decision on the part of the board how to move forward at this point. And one option would be to reduce the grants and pay for more staff. One might be to reduce staff and have those funds available for administration and grants. So this budget discussion today is really just letting you know what I've found in the short time that I've been working on it, and that I look forward to meeting with each of the board members to talk about their expectations. Now, because of the Brown Act, I can't go from member to member and tell you what the other person said, play the telephone game, but I can consolidate those comments and bring them back to the board for an open discussion about the future of your services. This concludes my report.
Great. Thank you, Dave. Yeah, when I saw the numbers, I thought the same thing. We're kind of going back to our discussion that we had before selecting an executive director. We did have the maximums there per month, but I didn't believe at the time we would even be close to those numbers. Again, looking at it as more of a admin person versus executive director in a traditional sense. So that's what I was looking at, is more of a admin person that could do all the behind the things we needed to, but I didn't believe it was going to take X amount of hours to even get near our maximums. So again, you'll kind of have to kind of gauge where that might be once. Again, it's going to take a lot to ramp up, to grasp everything, help us kind of fix what we need to fix. But then it could be almost a autopilot going forward, where it's just kind of filling in the numbers or just sending out the agendas, the minutes. I think we'll know as you move forward, and if that's even something that you would continue to want to do.
That's entirely possible. And I think a lot of that will rest on the districts, the board's agreement of policies and procedures which guide its grant program. And if it can get to autopilot, then that's a good thing. And that has its own budget benefits. So yes, let's move forward. It's a pleasure working with this board and working on those very questions. It may end up with my unemployment, but it's all for the good.
The only thing I just wanted to comment on is this item is listed as approval, and I think you really mean more discussion and approval at the June meeting, correct?
I would recommend that we do have approval at the June meeting, but today it's really discussion and direction. Have anyone to blame for these agenda mistakes?
I'll take
I'll have to come up with somebody.
Any comments from the board? Public comments? Okay, with that said, we'll move on to item number 10, workshop, district goals and policies.
We have item 9.3.
Oh, yeah, I'm sorry. Yeah,
Oh.
the third item.
Oh, I did. Sorry. I'm getting ahead of myself. Number 3, selected an alternate member of the RFP review committee. Now, I have had, board member Rosemary, Elenise, volunteer. And this alternate would be in the event that Danny is unable to attend once we do start getting RFPs, the proposals back in, to be a part of that review. Again, hopefully Danny will be available, but in the event that he's not, we need somebody as an alternate to fill in for Danny. I don't know how to proceed. We want
Well,
to,
you are the chair and you can appoint, but that's just the way that it always works. So there's 2 other members here, or there's, you're not at the meeting and you lose out for Rosemary. But I think it's totally your call so long as the person wants to serve in that capacity.
Letty, Lorraine, you interested in being the alternate or Rosemary? Rosemary,
Yeah, sure, if she wants to do it.
she's
She might as
expressed
well.
interest.
She'll be all right.
Okay,
Sure.
all right, so Rosemary will be our alternate. Thank you. Okay, item number 10, workshop on district goals and policies. Dave did a really good job putting together, have it here. Workshop on district goals and policies. My thought on this was instead of going through all of the items, I think a lot of these items need quite a bit of time to review, discuss, and then make changes to. My thought was a separate meeting specifically for the purpose of this workshop.
For the June meeting?
No, but we gotta put it in place for our proposals before our next proposals come in.
If we keep the current process, we don't, but if we want to make changes to it, I'm almost thinking we would need a special meeting specific to all of these items.
You certainly could. Just to be clear, though, the agenda item number 10 is a workshop on the overall goals and policies of the district, not necessarily specific to the RFP. You've kind of already, that concept, I think, is, or if I'm correct, right?
Correct.
Because I wasn't involved. It's kind of left the barn at this point for this year. But this is sort of like future goals and also the development of some district policies to kind of fine tune like finance,
Mhm.
budget,
Mission
grant
statement,
making,
district
mission statements. So
goals.
there's a lot of different items that I think are kind of incorporated
You're
by
saying
this.
that we can't add to the proposal policy what, if they're gonna come and ask for money from us, we can't.
Oh, you can always do that. I didn't mean that. I meant for the
That's
RF.
that's what I wanna do.
Absolutely, totally fine. I just meant with
I
respect.
just want anybody who's gonna come up and ask us for taxpayer money, they need to show us the financial report for a full year. We need to start seeing where they get their money, where everything that comes and goes, like they say, we're doing a fundraiser. Okay, well, we need to see your a full year. Don't you think that would be fair? Because don't get me wrong, I have no problem with people constantly coming back. That's fine, but we need to see where where their money is going to. We need a financial report from people coming to ask for money here.
Did we have that already in the policy
No, it's not.
for financial?
Are you talking about the mini grants?
Yes, yeah. Where we ask
I don't-
for 1 year's, I think 1 year's of financial.
I don't want to say
but-
anything untoward, but it seems to me that although this is not an action item per se, there is no reason that the board could not provide direction to the executive director and legal counsel to throw that in
Okay,
as
so then
another
we just
item.
have to alter the policy, the proposal that's on the website, correct?
Yeah, exactly.
Okay.
The policy, the overall grant-making policy. Yeah, I mean, I
Okay.
can't see that as being an
That,
issue.
that shouldn't take,
You have it out.
Well, we've got, there are funding restrictions. And that could certainly be, a characteristic that the board wants to see. And that is a history, like a 1 year past history
Yeah.
of the agencies or the organization's
sure, 1 year's
budget.
good.
That's, we don't support the following, so we can add that in under the evaluation
Yeah.
of applications. So
Yeah.
I don't know why we just can't add that in now.
I mean, that's all I'm asking to do. I thought that we were gonna go over from the last time when we met and we weren't able to.
Yeah, that is not a problem.
Okay, perfect.
So it's the organization's own budget for the past year, which includes their fundraising, their sources of revenue, their expenditures.
Financial statements
Mhm.
and
'Cause then
also
they
their
get up,
990s.
just because they get up here and then they say, well, we did this. We're also doing this. Okay, well, let's
Show it to
let's
me.
see what you funded and what you didn't fund.
Yeah.
I mean, just,
And that'll show any grants that they may have received.
right.
And it will include there are these tax returns that nonprofits do called Form 990s. And normally there's about a 1 year lag, so you can ask them to fill in the gaps since the last posting of the 990.
That's all I want to add.
I can help you with that.
Okay.
Good. So would we, if we reviewed, our documentation here as far as the workshop goes, yeah, that would take a whole regular meeting. Do we want to sacrifice a regular meeting?
If you want to do a special meeting, you certainly can.
A moment, or don't you agree this would be a special meeting
Or-
to review, it's all needed. Everything in here is needed. We need to discuss
where-
the grants, the mission. We don't have
Oh.
mission statement, selecting a goal,
Oh, there we go.
through our district policies, evaluation applications, restrictions.
Are we going to add personnel in there too? And then we can have a special meeting and then do everything at one time or
That discussion, and we could talk about that then as well.
how
Well,
much
if I
time will
can-
you need?
If I can provide some context for this, that it was your staff's intent to take the policies that are in the RFP and the policies that are in the mini grant application and pull them out, because the grant application is a process for the applicants to submit. But that the policies are really it's the heartbeat of the district. Why is the district here? And I wanted to put those in the context of Health and Safety Code, which is your principal act that says this district has the authority to levy taxes and provide services. And the mission statement is how this board would interpret the law to say, these are the tools we're given and this is how we plan on using them. And then each of the policies is kind of like a mechanical advantage. You don't just lift the whole table, you lift a piece of it at the time. And so getting to what is healthcare? What is wellness? Is there a difference between healthcare and public safety? Is there a difference between healthcare and public health? So all these policies would then give more direction to the board and illuminate to the public what the board's mission is and how the board expects to get from point A to point B. And so this is my first attempt at putting all that together. It's not, it hasn't met your evaluation. We haven't discussed it. The public hasn't been providing any input. So it's a work in progress, what you see here. This is not the end. If there needs to be more financial information in there like this, we discussed, that would be a policy that this board is part of its fiduciary responsibility, wants to see the following information from those parties that are requesting a grant. And that could be a policy, but it's also starting to link back into the applications. So
Please put it in applications.
Well, if it's in the application, but not in the policy, that's the policy is the
both.
constitution of this board. So the policy document is how you present yourself to the public.
For now, we're adding it to the application. But I think what Dave is saying was, we'll strip out the policy components of the application and you'll adopt a new policy at that either special meeting or the next meeting or whatever.
And I'd like to compare the policy document to the bylaws. So we've had the bylaws here since 2018. The bylaws are an owner's manual, like the one in your car's glove box. And the owner's manual tells you how to run the car and what happens when this light comes on and when you should do things like rotate the tires. But the owner's manual doesn't that isn't the heart of this district. Doesn't say what it wants to do. It just says, here's how you operate. So the policy is the heartbeat of the board, and the policy manual with the mission statement. And that's what I'd like, that's what I would recommend that this board do, is actually create a policy document that anybody in the public can read.
On the
And
website.
on the web, yeah, of course, and accessible. But anybody can read it and see where the district is going and maybe where it sees itself in the next 10, 50 years.
Yeah, with that said, it's just, there's a lot of work that we need to do on these items. I just thinking that it really deserves our time for debate, and discussion. And during a regular meeting, I don't think we have the time to
I don't have a
to
problem
do
doing a
it.
special meeting.
Yeah, I think it's
Do it
worth it.
Before our next
Yeah,
proposals have to come in.
yeah.
April or May?
April?
I'm available April 30th and the rest of the rest of
October,
April's
no, I
not
can do
good.
April 30th.
April 30,
That's Tuesday, yeah.
I can do that.
Okay, special meeting?
The calendar open here.
Yeah. It works for
it
me.
hasn't, Amy is, I show there are no city meetings in this room on the 30th. Correct. Okay,
That's great.
Sure.
yes.
Great.
April 30th.
30, 30.
Right, Tuesdays are crazy. That's good.
Meant to be.
Available? Yeah, special meeting. That work for you, Dan, Joey? Okay, any public comment regarding the workshop?
Can you pass this? That's all, all the current statements and then all of the whole year.
Joey, the public comments, okay. With that item, we'll move on to item number 11. Executive Director comments, announcements.
You announced that. Paper better. I have it right here in front of me. Thank you. As I noted earlier that we've posted, with Joey's help, posted the updated voting zones. I think of them as precincts, but they're zones. They've been posted to the website with a link to county elections. I've had the opportunity to reach out to the city manager here and the city clerk, both that I knew them from earlier public agency work. So it's good to meet them and to make sure that we had this room when we needed it, as long as they weren't using it ahead of us. So it was good to see them. And that concludes my comments. Thank you.
Thank you, Dave. Item number 12. Board member comments or announcements? All right, with that, meeting's adjourned. Thank you.
Where did, just show me real quick, where does you go under that for to see that? Oh, okay, got you. Thank you.